All right, welcome to Making Sense of ADHD, hosted by Banyan Tree Women's Collective, and our two guest speakers. We have two doctors of psychology joining us, Ellie and Alex. If you'd love to introduce yourself, Ellie, if you want to go first.
Yeah. Hi, I'm Ellie. I have a PhD in clinical psychology, and I'm here today to talk about ADHD and making sense of it.
Hi everyone, I'm Alex and I am a PsyD, which is also a doctorate in clinical psychology. And I am actually in the addiction medicine department, but do have some experience working with comorbid ADHD and working with adolescents with ADHD as well.
All right,
Alrighty.
I'm going to take my spotlight off so that you two can do your presentation. And here we go.
Alrighty. Let me share my screen. Move this guy so I can actually get to the present buttons. Present. Just a moment. There we go. All right. Making sense of ADHD. So, ADHD, it's a big topic. There's a lot to go over. We won't be able to cover everything. Our goal today is to get through some of the basics. So essentially, what is ADHD? What are some of the classic signs? What to look for? What is the process of getting evaluated? What are some of the ways that ADHD can impact our lives? What are some of the main ways to get treatment? And then what are just some tips and tricks of dealing with ADHD in your life? And then where to look for additional resources if you're finding that you want some additional support after the end of all of this. So we'll kind of just dive right in.
Alrighty, so the number one question is what is ADHD? So ADHD stands for Attention Deficit Hyperactivity Disorder, which is a neurodevelopmental difference, so a brain difference, which stems oftentimes from genetic factors, but there is also some research exploring some environmental factors during pregnancy that may impact that diagnosis. ADHD must appear in childhood and last into adulthood, and it's a lifelong condition and not something that yeah, can be gotten rid of, but we can develop some coping skills in order to make symptoms a little bit less severe. Um, Again, it's more of a brain thing. It doesn't go away, but can be managed. So there's no such thing as adult onset ADHD, and many go undiagnosed until adulthood. And this is especially a common thing for women and minority groups. So and just to kind of emphasize that everyone struggles to focus, and as children, we all have behavioral problems, and at times, and we most of us grow out of those, and folks with ADHD tend to struggle a little bit more. And just to note this last fact here, it's about dopamine and difficulties with executive functioning, and we'll jump straight into that in a little bit.
Yeah. So with that, what does ADHD look like? We know there's something going on with the brain. We know there's disruption in our dopamine. We know that there's problems with that ability to kind of just make ourselves do something. But what does this look like? So there are a lot of different symptoms. It can look like struggling to pay attention to kind of more mundane, everyday tasks. And yet at other times, being able to like really focus on activities that are like really interesting to us, being able to like hyper focus for hours on end. It can look like getting really easily sidetracked. And so, you get up, you're going to do your laundry, and then all of a sudden you're cleaning the bathroom, and then you're halfway through cleaning the bathroom, and then you're cooking dinner, and all of a sudden you have 50 half-finished tasks and you haven't completed any of them. It can look like starting new projects and losing interest halfway through and then abandoning them. So, jumping from one hobby to another and never quite finishing it. It can look like being late a lot or, missing deadlines, just kind of like not quite being able to keep up when things are due. It can be procrastinating a lot or really like postponing tasks because it can be really overwhelming when you have so many things to do. You kind of just freeze until it gets too late until that pressure builds so much that all of a sudden you got to do it. But then you get it done really fast. Um, it can be kind of tuning out a conversation sometimes. Like you might be really interested in the person you're talking to, but you kind of just glaze over a little bit and your mind kind of goes off on its own little adventure, even though you want to pay attention. It can look like interrupting people. You're not trying to be rude, but you just have to say that thing right then, or blurting out answers before someone's even done asking a question. You just know what they're going to say and you just have to answer it. Can be forgetting about plans or appointments. You scheduled it, you made that plan, and it just completely slipped your mind. Can be getting really easily frustrated, quick-tempered or really emotionally sensitive. You don't take feedback super well. You take things really personally. Can look like being really fidgety, squirming around a lot, not sitting in your chair super normally, needing to, move your legs up in a weird position, having to just like shift around a bunch. You'll probably see that from me throughout this presentation. I will probably move around a good amount. Um, it can look like really impulsive behaviors. So like spontaneously just like going out and doing something, being one of those people when someone's like, hey, let's go see a movie. You're like, yeah, let's do it. No planning needed. Um, Impulse shopping, you're going to a store. You probably don't need that new set of markers, but wow, that looks really cool. I'm just going to get it. Or substance use. People with ADHD are going to be those ones where it's like, well, I'll just try it. Everyone else is doing it. I might as well. That like logical thinking doesn't always kick in until after you've already done the thing. And so it can often look like someone who isn't paying attention, who isn't thoughtful, who maybe isn't as intelligent or doesn't think things through. But that's not true. There are people who are very, very smart, who have the knowledge. It's just that impulsivity, it's that executive functioning, it's that, wait, can I pause and make myself think this thing through? Isn't quite working in the brain. That need to just act comes before our brain actually manages to think things through. And so it can really impact us in a lot of ways. And while this is a lot easier to see in kids when they're acting out in a classroom setting, a lot of times it can follow us into adulthood and it continues to cause problems in our lives.
So that being said, here's a list of the diagnostic criteria to receive a diagnosis for ADHD. And it's more than just a few of the behaviors that Ellie listed. So there has to be six or more of these two categories of symptoms here that I'll list in a second. And since ADHD isn't something that we can test by just taking a blood sample, doctors need to determine the diagnosis based on observable criteria. And there's a whole other process for that, which we'll go into later. Again, there are two separate domains of ADHD. One is the inattentive type and the hyperactive type. So some of the inattention symptoms include failing to give close attention to details or making careless mistakes, having difficulty sustaining attention in tasks or play activities, um, seeming to not listen when spoken to directly, not following through on instructions, or failing to finish tasks, having difficulty organizing tasks and activities, often avoiding dislikes or is reluctant to engage in tasks that require sustained mental effort, often losing things necessary for tasks or activities, becoming distracted by extraneous stimuli, and then becoming forgetful in daily activities. So those are the inattention symptoms, and one must demonstrate six or more of those symptoms. Um, Regarding hyperactivity or impulsivity symptoms, this can look like fidgeting or tapping hands or feet or squirming in the seat, leaving one seat in situations when remaining seated is expected, running or climbing in situations where it's inappropriate, again, referring to this risk-taking, um, being unable to play or engage in leisure activities quietly. Sometimes folks will use the phrases always on the go or driven by a motor to describe behavior, talking excessively, blurting out an answer before a question has been completed, difficulty waiting one's turn, or interrupting and intruding on others. And these symptoms must be present prior to the age of 12 and present in two or more settings. So across kind of the home domain, school, work, other settings, not just one. And so and then I think one of the main criteria is that there needs to be clear evidence that these symptoms are interfering or reducing the quality of social, academic, or occupational functioning. So some sort of getting in the way of quality of life or ability to function within these domains. And of course, just not better explained by a different diagnosis or condition.
Yeah. So within this, we've grouped it all under ADHD, but there are underneath that category three main types. So there's the predominantly inattentive type. So those are going to be your people who mostly have those inattentive symptoms, right? It's more that kind of distraction, but they're not having as much of the like fidgety presentation. And so they're going to get those six or more symptoms in that inattentive domain. They're not really going to have those hyperactive symptoms. Then you've got the opposite, the predominantly hyperactive impulsive type. So those are going to be the people that can focus okay, but they're going to be really impulsive, high energy. So they're not going to struggle as much with that sort of like inattentiveness, but they're going to be on the go. They're going to have high energy. They're going to be running about. And then you've got the combined type, which means they're going to be drawing from those symptoms from both categories. And now, with all of this, we are going to be seeing a lot of people getting diagnosed as children because a lot of times that's when people are noticing these problems come up. Because while most kids grow out of these behaviors or they're getting caught in elementary school where they're expected to sit down at their desk and raise their hand to answer questions and follow rules, and a lot of the kids with ADHD struggle with that. They get called out, their teachers go, "Hey, I think something's up," and they get referred for testing. There are those who do go unnoticed, and a lot of those tend to be women. We find that actually it's about like men are about 3 to 4 times more likely to be diagnosed with ADHD than women. And big part of that is because of sexism. Women learn to mask it. We are socialized to just be quiet and sit still. Or the ways that women are able to fidget is just seen as more appropriate. When women fidget, it tends to be more doodling or braiding hair or doing a craft, and that is seen as appropriate. Whereas for little boys, when they're fidgeting, it's playing with a toy in a car, and that's seen as disruptive. And so that gets them a referral. Whereas for little girls, it's, oh, that's a pretty art project. Let's put you in an art class. Um, very similarly, boys are very socialized to, okay, your play, you go being aggressive. Whereas for girls, it's, oh, you're just talking a lot. Okay, well, you're just gossipy. It's not seen as, oh, you have impulse control problems. You're just talkative. That's just a girl thing. And so a lot of the kind of gender roles get, swept up into this. And a lot of little boys end up getting the diagnosis, getting help, whereas many girls are struggling just as much, but don't get that same diagnosis, don't get that same help. Very similarly, but kind of almost to the other extreme, many minorities tend to be given that have ADHD tend to be given a more like stigmatized diagnosis. So they tend to be seeing these same behaviors, and instead of going ADHD, they seem to go, oh, that's oppositional defiant disorder. This kid, it's not a brain issue. They just don't listen to authority. They're just being defiant. Or they have intermittent explosive disorder. They just can't control their anger. Or they have conduct disorder. They're going to develop into a personality disorder and they're just beginning their life as a criminal young. They go, oh, because they're a person of color or they're a minority, we're not going to give them the benefit of the doubt. We're not even going to bother, assuming that it's just, this brain difference, this neurodevelopmental difference that honestly a lot of people have. And if you were to ask me, I think probably not many generations, we won't be seeing this as a disorder, but as just another norm. But again, because it's Black and brown people, they're going, oh no, we're going to stick this stigmatizing label on you and say you're a bad person, you're a bad kid, and we're going to shove you into another system that's just going to continue this cycle of not giving help and continuing to say, yeah, no, you're the problem. And so, despite actually meeting criteria for ADHD, a lot of times they are ignored. And then it's, again, not until adulthood or not until these kids are able to stand up and speak for themselves and go, hey, actually, I was given this diagnosis, but this doesn't fit. And I'm still struggling with these symptoms that match this other thing, and able to advocate for themselves, that they're able to go back, get tested, and people go, oh, yeah, actually, that's ADHD. And now let's get you help. And so, one of the big things here is while adult ADHD, like adult onset ADHD, isn't a thing, we do see a lot of adults getting diagnosed with ADHD because they were overlooked or misdiagnosed as kids. And a big part of that is cultural and systemic problems within the mental health system and the way that we are honestly looking and labeling children. And so, with all of this, it is important to make sure we are looking at ADHD as something that, yes, it's a brain difference, and yes, we have this label of it as like a disorder, but really it's just another way of looking at like how do brains work. And so with all of it, I think it's really important that we like take this label with a grain of salt and go, we can use this label if we find it helpful, but we don't want to be sticking labels on people if we find that it's going to be pushing them in a corner and adding some kind of stigma there. And so keeping that in mind when we're looking at these presentations, and keeping in mind that it could also be something else, whether that's something that is more intense or less intense.
Absolutely. And that's something that, Ellie and I as treatment providers are always thinking about because with these labels, it also confines the system to providing treatment for that one label and may be barring a lot of folks from access to suitable care. So it's important to consider other possible diagnoses that may be manifesting in similar ways as ADHD, or if, folks might be given a misdiagnosis, just like Ellie was sharing. So that really impacts treatment moving forward and whether or not someone gets the care, the medication, the therapy, the resources that they need at the time. So here are some comorbidities or co-occurring diagnoses that could be going along with ADHD, or misdiagnoses that could be confused with ADHD or vice versa. Um, the first one is trauma or PTSD, which could manifest in inattention or hyperactivity or both. If one has experienced a something that was traumatic, it could very well impact emotion regulation and ability to focus. Um, and then something that I'm very familiar with is co-occurring substance use with ADHD. I've seen a lot of folks who use marijuana to cope with their ADHD symptoms, to kind of calm the mind, to calm the motor. And I've seen folks, yeah, with both. And so, I think becoming aware of what treatment could look like for these co-occurring circumstances. Mood disorders like anxiety, depression, and bipolar disorder, again, can totally influence one's ability to focus and, use their decision making and impede on different domains of their lives in that way. Ellie spoke to this earlier, so behavioral disorders can very easily get confused, especially when it comes to implicit bias with ADHD. And that includes intermittent explosive disorder, conduct disorder, oppositional defiant disorder, which we've kind of, the field is kind of trying to stray away from those because they are highly stigmatizing and puts people in a box. So these other disorders may be more considered when thinking about these behaviors. Autism. So autism spectrum disorder, again, it is a spectrum of kind of neurodivergence. And considering that when, the symptoms of ADHD are appearing. Is this autism? Where on the spectrum are these symptoms lying? And kind of parsing through the different symptomologies because there's so much overlap. So being very careful when thinking about this. Learning differences as well. I think Ellie spoke to kind of how people are labeled in the academic setting, how folks are labeled as not smart or having these academic or learning difficulties when they just may be neurodivergent and thinking about things differently. One type of learning is not going to fit everybody, just like one type of treatment is not going to fit everybody. So considering those when looking at these symptoms as well. And then sleep disorders very much affect executive functioning and ability to focus and emotion regulation. So considering all of these when either thinking about ADHD symptoms, what could be co-occurring with ADHD, or maybe it's not ADHD and it's one of these. So always kind of thinking about the different ways these symptoms present themselves and considering all the possibilities.
And then considering too, is it actually a disorder or do we just have traits of this, right? As Alex explained earlier, everyone gets distracted. Everyone has some level of inattention. And so are we just experiencing certain traits or are these symptoms of a disorder? And it can be hard to kind of separate those. Are we just someone who has a distractible personality or is this a symptom of an ongoing disorder? And that's where really getting assessed and getting tested for these things can come in handy. It's also important to note, is it causing significant distress or interfering with functioning? That's one where maybe you are meeting diagnostic criteria if you look at it, but if it's not interfering with your life in a negative way, it's not a disorder. I could be meeting criteria for autism spectrum disorder or for anxiety disorder, but if it's not negatively impacting my life, it's not a disorder. If I'm able to function just fine, then there is no need for me to have that label because it's not negatively impacting my life. I can have that label if it's going to benefit me in some way through getting me accommodations. But, if I'm not getting anything out of it, then, if that label's not helpful, then I don't need to add that stigma to myself. And so it's really about, why would I need this label? And then again, yeah, can it be better explained by something else? A lot of people will go straight to ADHD, but if my distraction can be better explained by anxiety, then treating the anxiety might be a better route than just instantly giving someone medication or trying to, fix ADHD when it's actually anxiety driving the bus. Because we want to know what's at the root of the problem in order to efficiently treat it. And so, again, this is why it is important to really work with professionals or get that real assessment done rather than trying to self-diagnose. Because while these symptoms can be coming up, we want to know what is at the root of the cause so we can actually address what's going on and have effective treatment be in place.
Yes, and just to kind of go off that idea of how, I mean, I feel like mental health has become a little bit less stigmatized, but still very highly stigmatized. I think some of these labels have an added burden and stigmatization to them, including ADHD. So a lot of folks who are experiencing these symptoms experience difficulties with their interpersonal relationships, with their peers, and might feel that rejection from others, from the friend group, because they're having difficulty tracking or having difficulties, keeping up with what folks are saying or thinking about the next thing in the conversation, which is something I've heard a lot with folks, having those symptoms. And it may be difficult to engage in those social interactions. There's also an added financial burden. It's estimated that people with ADHD spend an extra 14 to $18,000 a year replacing lost items, on medication, late fees, fines, treatment, which is, a lot to say about the field itself and how just not accessible things are, and which is added to, a big part of the stigma as well. Divorce, so marriage strain, relationship strain, and how these ADHD symptoms can impact these close relationships as well. And especially if, the other person may have their own difficulties in their mental health and how that they may be at play with one another in the relationship and how much distress that could cause a marriage. Um, and then job loss. So again, with these difficulties in executive functioning, um, attending to different tasks, and difficulty with attention in general, could result in job loss as well, which, impacts financial situation. Um, and then overall, just risky impulsive behavior that could impact safety. Um, Ellie spoke to some of those earlier as well. And one of those behaviors can be substance use and engaging in risky substance use, um, driving while intoxicated, taking these risks that, yeah, put one in danger. I remember, a story that a patient told me about their driving behaviors, and they have symptoms of ADHD and, driving through red lights and just, not being able to figure out why and having this label explain it was really, helpful for them to get the right treatment. So all of these can just add extra stressors and, um, yeah, emotional burdens on folks who are experiencing these symptoms.
But with that added burden, ADHD is also a hidden secret superpower. And so with that, with any superpower, with great power comes great responsibility. We need to learn how to train it. And so when working with kids, this is one of the ways I try to frame it. You know, Superman, didn't come out here and instantly start saving the world. With super strength, he had to learn how to not crush people when he gave them a hug. If you had laser eyes, you got to figure out how to turn them on and turn them off because you don't want to look at someone and accidentally like blast them to bits. So ADHD is just like that. There's a lot of things that are working against us, but if we figure out how to control those parts, we can also figure out when to turn it on. And when we do, there are parts of it that make us really awesome. If we can figure out when to turn on that hyper focus, yeah, we can get work done really fast. Like if you're in the zone, you can do like a week's amount of work in a couple hours. Like when the pressure's on, you can work so much faster than your colleagues. People with ADHD tend to be really funny. Like, I don't know if this is just the people I know, but like that quick wit and humor, it just tends to come along with ADHD. Your brain's connecting things so quickly. Like, you tend to make pretty good jokes. People with ADHD tend to be really creative. They tend to be good at art or just like figuring things out, building stuff. They tend to make great engineers, great artists. They tend to be pretty energetic. And that's great if they're into sports, right? They tend to be the people who are super fast. This is great when working with little boys. Like you tell them you can be the fastest kid on the playground. That's a great motivator. But like even with adults, having that energy, yeah, you'll be the life of the party. You'll be that person who's able to stay out and keep the party going. You'll be that person who's able to keep going on that hike. You'll be the person who's getting everyone hyped. Being competitive. This one's a double-edged sword, right? It might mean like you're the person everyone wants on their team when like it's a really intense thing. Like if there's a prize on the line, you're going to lock in, you're going to get it done. But okay, maybe if it's trivia night with like the in-laws, you might have to kind of step back because it might get a little too heated. This is one I'm currently working with a kid right now when we're going through and we're figuring out what games can we play and what games can we not play. And sometimes it depends on the group we're playing them with because sometimes we get a little too intense and we don't want to lose friends. Multitasking, again, depends on what we're doing, but people with ADHD tend to be pretty good at multitasking. Like neurotypical people tend to be able to like focus on one thing and that's it. People with ADHD, you kind of have like 20 trains of thought going at once. And if you get the right combination going, you can be watching TV and working on a creative project and eating some food and like talking to your friend all at once. Like you can be having a bunch of things going. Um, again, fast at completing work, super calm in crisis, right? Because Your brain's pretty much always in crisis. It's because it's doing so much. When you have those moments of like, oh my God, someone's bleeding, someone's hurt, you lock in. You're so good. People with ADHD make great first responders. They're able to keep their cool and just do it. After the fact, we might have a little bit of a breakdown and need a little bit of help to process. But in that moment of crisis, people with ADHD, amazing. And yeah, that intuition, your brain's working so fast, it's picking up on all these cues. You might not realize that you're processing all these things, but you're able to read people pretty quickly. You're able to pick up on a situation and go, something's not right here. So yeah, there's so many secret superpowers hidden within ADHD. So if you're able to control the stuff that is making life harder, then you can unlock these superpowers and you figure out, ADHD may actually be taking humanity to another level. We just got to figure out how to control the stuff that might be making our life a little bit hard first. So it's not all bad. We just got to find that balance.
So to start the process, here are an overview of the steps to take to get diagnosed. Starting with you're doing your own research, maybe very carefully scanning on social media about with research-backed articles or yeah, hopefully research-backed TikToks, looking for signs that you may identify with or things that stand out to you that feel like you're experiencing in your life. Taking some online screeners, then talking to your doctor about possible symptoms that you might be experiencing. Getting a professional assessment, go to a therapist or the only people who can do assessments are licensed psychologists. So being able to access that as well. And then, or getting a diagnosis from a psychiatrist or an MD. Ellie, we had a question in the chat that I think would be
Ooh, yeah.
very applicable to your next slide. I don't know if you can see that.
Ooh, okay, yes, let me pull up.
Yes, or I can read it to you too. It's up to you.
Ooh, yeah, it's definitely hereditary. Yeah. So yeah, our question is one person in the chat mentioned that like they're constantly distracted, and they know that like their daughter has ADHD, and so they're wondering like if it would be beneficial for them to get tested. And yes, we have the research shows that definitely ADHD is highly genetically linked. And there's more and more research showing that it's actually looking to be more of a dominant trait, which is one of those things why I am suspecting that come the next few generations, it'll likely drop off this disorder list because given that dominance in the gene pool, it means that more people with ADHD, if either parent has it, the kid is likely to have it. And then that's going to keep passing along until it's going to become more common to have ADHD than to not have ADHD, which means if everyone has it, is it really a disorder or is that just the new normal? Um, but yeah, definitely worth getting assessed. Can I click? Here we go. All right. Yeah. So how to get diagnosed. Step one, what to look for. So number one is research. You guys are already starting that. You are here. You are looking into what does it look like and how does it present. Good job. You can check that one off. Um, the next step is taking a look at your own life. Notice like what symptoms are present. When do they happen? Are they happening in different situations? If you're only getting distracted at your job, but not at home, or not when you're with other people, or not at school, might not be ADHD. You might just have a boring job. But if it's happening in different places, okay, yeah, might be ADHD. Is it having a negative impact on your life? Okay, yeah, that's another check for maybe I should get some help. How long have these been present? If you look back and you're thinking, huh, yeah, I struggled with this in like elementary school too. Okay, yeah, probably ADHD. If you're thinking, oh, no, wait, I didn't struggle with this until college when like that one really bad, scary thing happened. Okay, maybe that might just be more of a trauma response. And maybe we might still need help. We might still need therapy. Might not be ADHD though. It might be trauma that's presenting similar. Again, you want to talk to your family. If you have siblings, caregivers, anyone who knew you from your childhood, ask them if they noticed any of these symptoms. Because again, it's going to be something that's been present your whole life, even if you weren't fully aware of it. And then ask yourself too, like, what would getting this diagnosis mean? Because, you want to make sure it's something that's actually going to benefit you. If getting this is going to give you peace of mind, awesome. If getting this diagnosis is going to give you access to resources, to accommodations, to just overall treatment, great. But you do want to make sure too that, if you are living in an area or you are working in a job where, this is something you might have to disclose. Hopefully it shouldn't be. But, if you are going somewhere and it's like you have to disclose any existing conditions that you have and it could work against you, you want to make sure that, one, you know your rights and you don't really have to disclose it. But you want to make sure that this isn't something that's going to come up and work against you. And so, if you're getting it done through your job, or like if you're getting it done for your kids through school, you want to make sure that it's one that they're going to get an IEP for. They're going to get a 504. It's going to benefit them through accommodations, and it's not going to force them to be taken away from the classroom with their friends. You want to look into, with this diagnosis, what could happen, both the benefits, but are there any consequences that could come with it? Again, in this day and age, with more acceptance around mental health, those consequences are getting fewer, but you want to look into it just in case, because you don't want to accidentally have something happen where you get this diagnosis and it limits opportunities for you. And then with that, gather any information that you can. So any old report cards, any, documents that you have from old teachers, anything that you can think of that might be helpful in showing these symptoms. Talk to your romantic partners. Hey, is there anything I do that like you think is like weird or that you've noticed that like is just like a habit I have that you don't do? Like when I lose my phone all the time and then all of a sudden it's in the refrigerator because I went to get milk and I had my phone in my hand and then I put it down and I got the milk and now I can't find my phone for 3 hours. Happens to me all the time. Um, like figuring out things like that, where are there other people I can like outsource to gather this information? And that'll help kind of with that next step of, okay, once I have this data, now I can go and look at screeners and answer questions.
Yep, and here is a screener that we definitely include in our assessment process. There are online screeners available to see if you meet the base criteria for ADHD, kind of in the here and now, and make sure that they're backed by the scientific research and not just someone telling you something or something not reliable that you found on social media. Just make sure that they are, research founded. Um, so yes, we do use the Adult ADHD Self-Report Scale, or the ASRS, and you can go to this link, take a little picture of it, and you can take that screener and see if you meet the base criteria for ADHD.
Yeah, there are lots of screeners out there. I will say the ASRS is one, probably just Google ASRS ADHD screener and multiple PDF versions will come up. This is one that the World Health Organization uses, so it should be widely available online. Um, there are multiple different screeners out there, but this is a good base one that if you brought it to your doctor, they would likely accept or at least know what to do with it. So this would be my primary recommendation. And then you could use other ones online, but I would say just be careful of any that are trying to sell you anything. I'd recommend doing any of the like free PDF ones from a university or like from the CDC, WHO, like any kind of reputable source that don't have a now go buy this or subscribe to our mailing list attached to it. So once you take that screener, you take all the information you've gathered and you bring it to your doctor. This could be your primary care physician, a therapist, a psychologist, really anyone who is connected to that medical field, because it can be really hard to find a psychologist who is engaged in testing on your own. You know, if you don't have a main doctor you're already connected with, you can engage on that searching on your own. I would recommend looking at like Psychology Today's website, really starting with kind of just like Googling, like psychologists, assessment clinicians, but really doing that initial groundwork yourself is a headache. Like even as a psychologist myself, like going in cold turkey and trying to find people is hard. A lot of our referrals come through just knowing people in the field. So it really is easiest to go to your doctor and say, hey, do you know someone? If you are really struggling to find someone or your doctor is only referring you to people who are really expensive because unfortunately testing is pretty expensive, I would recommend looking at universities that have clinical psychology programs because a lot of these will have, like the training programs, will have clinics that they partner with as training clinics. And a lot of the training clinics will operate on sliding scale fees or low income fees. It can be tricky to find them, but you'll want to start with like university that's in your area. So for here, you could do University of San Francisco Clinical Psychology Training Program Clinic. And from there, once you Google that, you could see, okay, do they have a clinic name? Just by looking at their program, does it list clinics that they go to? And from there, you could see, okay, do any of these offer assessment services? If you're really struggling from there, you could even just try calling the university and asking. Um, but I think that's a little known fact is really going through the universities that teach psychologists because they have to train us somewhere. And the places that do the training usually offer things at lower fees. And we have to get trained in assessment somewhere. And so usually going through those routes is a place where you can find a little bit cheaper services. That being said, the wait lists are usually pretty long because those services are in high demand. Again, if you do have good insurance or you do have a doctor who is able to refer you to someone, that is usually the easiest route. Now, it is important to keep in mind some therapists and some psychiatrists may give you a diagnosis without testing. You see this a lot specifically with like psychiatrists who might just give you like medication for ADHD without going through that full testing process. And so they might put a diagnosis on your chart, and this is in order to bill for it for insurance purposes. This is different than having the actual diagnosis. And so this is one that the doctor that you're working with might accept, the insurance company might accept. But if you were to take that to a different agency, if you were to take that to a school, if you were to take that to a different insurance company, they might not accept it. They might require you to bring in the testing paperwork. And if you did not go through that testing process, they might say, this diagnosis is invalid. We won't accept it. And so you do have to be careful about that. That is one that I experienced where, my own personal therapist was like, oh, girl, you have ADHD. I don't even need to do the testing. I see it. Went off to college and they were like, no, you don't have the paperwork to prove this. And so then had to go through the entire testing process again. And then they were like, oh, yeah, no, you have ADHD. And I'm like, yeah, I told you. Um, and so you definitely, if you have someone and you're able to get that treatment without the testing and it's doing its job, okay. But definitely be wary of that. If you're just given that label and you're given the treatment, good. But note that that might not follow you to other doctors or other clinics.
So once you do find a an affordable way to get a formal assessment. This is the kind of a summary of the process that it could look like. So there are multiple parts to this assessment. Usually they do review your documents. So if you have taken that screener, feel free to bring in your score and all your paperwork, the report cards from previous schooling, any kind of evaluative, I guess, scores or things that could kind of show how you grew up in terms of if you were able to function amongst the academic domain, or even just, reports from teachers or parents, any kind of things that you can dig up. Um, and then likely the psychologist will conduct a clinical interview, in which they will just kind of ask about your background, the reason why you reached out for an assessment, just to gather some more information from your words in particular. And then they'll likely send you a bunch of questionnaires, which are about so many different things, just to kind of, again, referring to the previous slide regarding possible comorbidities or other possible diagnoses. We just kind of want to get all the data so we can have a fuller picture of who you are, who the individual is that we're testing. So there'll be a bunch of questionnaires to answer as well. And then lastly, but most importantly, I will say the test battery. So um, you will be going in person, very likely at this point, to engage in many of these tests, and that could be tests on cognitive functioning, executive functioning, or just like across the board, any kind of um, in vivo test that will demonstrate any difficulties that ADHD may, how ADHD symptoms may impact these behaviors. So, but these test batteries are, based off of the practitioner's point of view in terms of how they kind of create these batteries. So it may look different for different psychologists, and it may look different based off the individual. So not all testing batteries fits every patient. It may vary in terms of your symptomology and your background paperwork. These assessments are very long, which also contributes to the long wait lists. So typically, Ellie and I will schedule appointments for, at least I do, 2 hours at a time, and we'll just kind of do these chunks until all the test batteries are done. Um, and then again, multiple visits as well. And then after all the data is collected, it might take a little bit for the psychologist to write up a report and go through all the data. And an assessment report will be written for you by this psychologist. Sometimes they might write a letter for you as well, with kind of the data backing any kind of diagnosis that they're giving. And then again, a summary of all the findings from the battery. Uh, and they'll likely schedule a feedback session with you as well. So to go over the data with you, they won't just like hand you the report and expect you to read it and interpret it on your own. They'll likely go through it with you and show you the data points and kind of how things went during the whole process. So it was a very long process, very expensive process, unfortunately. So just like Ellie said, it's helpful to get these hacks and find a place where they do sliding scale assessment because it's a long time and very tedious of a process. So yeah, important to know what you're getting yourself into.
Yeah. Oh, went too far. Yeah. And so then once you do get that back, if your assessment was not done, in-house by a clinician that works like right with your therapist, you'll want to take that form back to the doctor that referred you or your own therapist to then discuss what are the treatment recommendations. Because that assessment clinician is going to be expensive. And so while they will go over that report with you and they'll give you a couple brief recommendations, you'll want to work with someone after the fact to figure out what is going to work for me. Because as we go into kind of these next sections of, more of these tips and tricks that work for people, you'll realize that just like everyone's different, what works for everyone's different. And so there will be a lot of kind of fine tuning to figure out based on you and your exact ADHD, what are the skills and what sort of therapies are going to work for you. And so you'll want to discuss with your doctor what form of treatment is going to be best suited for me and where can I go to get that.
So here again is kind of a summary of how ADHD is treated, so the treatment modalities that folks typically engage in. First and foremost, medication, and then psychoeducation, so getting that information, doing that research on your own. Behavioral intervention, so learning coping skills, changes in behavior in order to cope with these symptoms. And then tools and skills, similarly to learn how to manage life and all the ins and outs of these symptoms and how to make life a lot easier and not create so many barriers to getting resources, to getting help, to getting support.
Yeah. So first off, medication. This is one that definitely like 10, 15, 20 years ago, this was all the rage. Doctors were just, yeah, put everyone on Ritalin and it'll cure everything. Then there was a huge backlash of no one can get any medication. Now we're somewhere in the middle where it's extremely regulated and difficult, but for those who need it, it does really work. The main one we see is stimulants. This is going to be your Adderall, your Ritalin, your Focalin. These work off of dopamine and norepinephrine to really just kind of like boost these chemicals in the brain. These are going to increase alertness. They're going to increase that reward sensation and stimulation tied to tasks. So it's going to help with that ability to focus. It's going to help with that sensation of accomplishment. It's going to help you engage with the boring things. Um, One of the tricky things here is it's not a magic pill that'll help you get things done. Sometimes you will take it and it'll help you get the thing you want to get done. Sometimes you will take it and you will get something completely unrelated done. It helps with that focus, but you might focus on the wrong thing. So you still need the behavioral intervention to help. Another thing to keep in mind is many people will say, well, I took Adderall and it helped me focus, so I must have ADHD. That's not true. If you take a stimulant and it helps you focus, congratulations, you're human. They work for everyone. It would be like saying I took cocaine and it made me feel awake. Um, yes, that's just how it works. Stimulants work on everyone. Uh, that is the case. One of the things that might be a sign that you have ADHD is if you took a lot of stimulants and everyone else was feeling up here and high and you took a nap. That might be a sign you have ADHD because while everyone else was like, oh my God, it actually helped level you out and help you feel normal. Um, so that might be a little bit more of a sign there, where it's actually bringing you back down to where everyone else is. And then another one that we're seeing more commonly that's not a stimulant is Strattera that has been found to actually be very helpful with ADHD, again, helping with that focus. That's not working on that same stimulant level, but has been helpful in kind of grounding people. So again, if you're looking for more of that like medication help, these can be helpful, but again, generally not recommended completely on their own. You still want to be adding in behavioral interventions, some just like general like lifestyle modifications, because if we're purely relying on an external pill to help us focus, it's not going to do it. We'll just end up focusing on the thing we were distracted with before. We still need some lifestyle changes to help direct that focus.
Absolutely. And one of the ways that we can kind of jumpstart this process is psychoeducation. So learning about ADHD, which you're doing right now, learning about the symptoms, learning about things you identify with in your life, things that you struggle with, and then destigmatizing it, being able to talk about it with other folks, being able to even connect with other folks. Like, do you experience this too? Like, let's talk about it. And noticing and acknowledging that there is nothing wrong with you. Ellie spoke to it beautifully earlier, that this is a superpower and this is, you know, boosts of creativity. And I agree, like all my friends with ADHD are like the most hilarious people in my life. So just, recognizing that there are so many strengths that come with yeah, not necessarily I feel like the diagnosis is it just is stigmatizing itself. But I feel like, there's so much depth to these behaviors and experiences within. And noticing that there is help and accommodations, whether you're in school or at your job. again, with the destigmatization, being able to voice that you're going through or experiencing these symptoms, kind of the ways that it impedes on ability to be productive or get things done at work, and being able to normalize those conversations, even if it is difficult, specifically in these more evaluative roles in our lives. Noticing common themes and trends or patterns in our lives and being able to name them and notice them without judgment, and then processing them in therapy, being able to go to someone again to practice talking about these symptoms and behaviors that may not be normalized in society, but can be talked about in a safe and non-judgmental space.
The next big one is behavioral interventions. And so this is going to be like your gold star of treatment for ADHD. These are going to be the ways that we can train ourselves. This is basically treating ourselves the way we would treat a new puppy, that, plain reinforcement. How can we reward ourselves for the things that work? And how do we try to kind of ignore the behaviors that we don't want? How do we decrease those? This is the number one thing that we do with children. When working with kids with ADHD, yeah, we'll do a little bit with them, but we do a lot with the parents. When it comes to adults with ADHD, we're doing a lot with them, but again, we're going to be recruiting their romantic partners. We're going to be recruiting their family and friends, because again, with ADHD, we're forgetful. We may not be noticing all of the things that we're doing, but I guarantee you the people around us notice the things that we're doing. And so if we ask them for help and we go, hey, when I start interrupting you, can you just like put up your hand so I remember? One I noticed that my little cousins did was when I started interrupting, they would just go, hot dog. And I thought it was so funny. Like it wasn't them going, you're interrupting, you're being rude. They just were like, hot dog. And it just made me smile. And it helps me learn because I started realizing, oh, I'm interrupting. And I would just go, oh, and it would make, because like when I would go, oh, they were like, oh, it looks like you're eating a hot dog. And so they would go, hot dog. And I go, oh, and it helped. It drew attention to it for me, and I slowly stopped interrupting them more and more. Um, so this is, one where you want to recruit the people in your life to help you with the things that you want to reduce. And again, as you start doing more better with the things that you want to reward yourself, like we want to like notice when we're doing good and celebrate it. So yeah, like if I was doing good and I didn't interrupt them, they would like give me my own gold star stickers, or they would like reward me by giving me high fives. Like, I'm having little 5-year-olds train me on how to have good etiquette, but it's rewarding when a 5-year-old gives you a high five. It's super cute. Um, you know, Noticing patterns, whether it's you noticing them, other people noticing them, like what tends to help, what makes things worse. You know, this could be, huh, when I don't eat enough food, I tend to get really emotional. This is with everyone, but with ADHD, when we get emotional, it tends to be at extremes. Um, you know, huh, when I don't get enough sleep, I tend to be all over the place. I'm even more scatterbrained. Um, wow, okay. When I know what my plan is for the day, things are good. But when something goes wrong or is like not in the plan and then I'm thrown off, I have no idea. Or when we're going someplace new and I don't know how long it's going to take me to get there, I think I have time and I actually don't. So I need someone to actually show me how much time it's going to take instead of me assuming I can get there in 15 minutes when it's actually going to take an hour. So figuring out what's going to help. Changing the environment, right? Because as much as we think we can change our brain, by the time we're 25, it's pretty set in its ways. Like we can help do things, but we're not going to be able to change the structure of it too much, but we can change our environment. So if we're running into that coffee table every day and wondering why we're getting bruises on our legs, instead of going, I need to keep remembering that that coffee table's there and take 3 steps over, what if we move the coffee table? What if we just change the environment knowing that, yeah, I'm not gonna go around. I'm gonna keep trying to make a beeline to the stairs. So why don't I just move the table? And then, yeah, maintaining good health is going to be super important. It's important for everyone, but especially when we're dealing with stuff in our brains, we want to make sure that our bodies are equipped to deal with things in our brains. So, good nutrition, exercise, sleep. We want to make sure we're taking care of ourselves so that we are equipped to manage any fluctuations that might be coming about.
All right, and just to quickly go over some tools and skills, Ellie and I were speaking earlier about how it's not a one size fits all for these tools and skills. So you're going to have to try a few, and some of them might not work, some of them will work, and it's a really tedious trial and error process, and that's okay. That's completely normal, but just try it and experiment with what works for you. So some of these examples include using a planner, making some lists, creating a schedule, having that structure put in place, so that it's a reminder. Put it in front of you in your desk, put it in front of you in your office, and then set alarms, set reminder alarms. I had a friend who would kind of switch from task to task every 5 minutes because she couldn't focus on one for more than 10 minutes. And so she set an alarm, it's like next one, and then go back to the other one to keep that mental stimulation. So setting alarms to remind yourself. Again, building routines, that schedule, that structure into your life so that it becomes a little bit more normal. Breaking down big tasks into baby steps. And I think that we could all take a little note from that and not taking on too many overwhelming or huge projects. Setting up that reward system, just like Ellie was talking about, those built-in rewards, whether it's from you or from somebody else, anything that'll get that reward system going. And then practice those emotion regulation skills, that grounding, the deep breathing, and kind of mindfulness, just to calm the emotion or the nervous system, so they're not on high alert all the time.
And then some of my favorite tips and tricks. So, number one that has like been a lifesaver is time yourself. This works in multiple ways. Number one, if you're timing yourself to do a task, it's a challenge. It makes it exciting. You try to beat that timer. You try to beat your own time. Okay, last time I did the dishes in 5 minutes. Can I do it in 4 minutes and 50 seconds? Similarly, time yourself before you do something, and then you know how long it takes you to do that so that now I know, oh, it actually takes me half an hour to fold my laundry instead of the 15 minutes that I thought it would take me. So now I know I actually need to plan for half an hour. Um, Automate what you can. Uh, we have all this technology. We have smart houses. Take advantage of it if you can. I, again, work with another kid who really struggles with his nighttime routine. So entire family got on board where an alarm goes off at 7:50 to let the entire house know. All right, we're putting down electronics in 10 minutes. At 8 o'clock, all of the lights switch from bright light to a warm light and all the lights turn down. And then another alarm goes off and the Wi-Fi shuts off. And like they have it all automated and like with reminders and everything so that mom doesn't have to remember. It does it for it and there's no fight between mom and kid. And like the lights and everything are attuned so that like everyone does it. Um, Buddy system, parallel play, like have people to help you. Um, a lot of times I don't want to do my work. And so I will invite friends over and I'll be like, hey, do you want to sit on my couch and watch a movie as I clean my house? Because sometimes I just won't do it unless there's someone there to make me. I'm like, you don't have to do any of it. You can do exactly what you would be doing at home. I just need you to do it from my couch so I get my work done. Um, or like very similar, exercise. I know I should be exercising. I know it's good for me. I honestly have a lot of fun when I go and do it. But getting myself to go, it's not going to happen unless someone else is waiting for me to go and do it with them. If someone else is relying on me to show up, I'll be there. But if it's on me, I'll make excuses all day, every day. So, yeah, I make plans with someone because that'll force me to go. Uh, Make things more fun, challenging, turn them into a game. If it's just, oh, I just got to do this thing, it's awful. But if I can make it into a game, if I can make it more challenging, if I can turn it into, can I beat my time? Can I do it faster? Can I do it better? Can I, see if I can get more done than my partner. It becomes a little bit more exciting. Um, Representing time physically or externally can be very helpful because again, time's not real to me. It's a magical number that just comes and goes, and it doesn't have any real meaning in my heart. So getting some of those like big clocks that they use in classrooms where like the time you can set the time and it's got like a red chunk that slowly ticks down. Like if I'm doing something and I am on a serious time crunch and I need to be out of the house in actually 5 minutes, yeah, using one of those big time clocks that shows me the time ticking away. Sometimes I need to see it. Don't fight an unmovable force. If you've been trying to change a habit for so long and it's just not happening, sometimes we just got to work with it. I don't drink enough water. I hate water. Water's boring. Still water is gross. I just don't do it. For so many years, I was like, if I buy the right water bottle or if I just like do the right thing, never happens. And eventually I was just like, you know what? I give up. And so I agreed that, like, you know what? It's okay. I will just drink 5 cans of sparkly water a day. At least I'm getting some water. For the longest time, I was like, no, that's so bad for me. I'm wasting so much money. It's probably bad for the environment, but it's better than me being dehydrated. And so, yeah, sometimes we can't be the best, but we do what we can. And so instead of trying to be perfect and, be like, no, I can't have all the sparkly water, but then I'm just being hard on myself and not getting any water, I'll meet myself halfway. I'll drink the sparkly water. At least I'm getting something. Communicate. Uh, Communicate to your boss, and when you're in a meeting and you're doodling, it's not because you're not paying attention, it's because you need to do something with your hands so that you can pay attention. Communicate to your partner that, hey, the reason you didn't reach out for sex in the past week wasn't because you're not into them. It's because you literally forgot that sex doesn't ex like that sex exists because it wasn't right in front of you. You do love them. You just like have no sense of object permanence, and so you need them to remind you. You didn't forget that your friend isn't there. It's just because when you didn't see them that week and they texted you, you saw the text and then you thought you responded and then you didn't, and then you didn't have the notification up anymore. And you thought you mentally sent it and then you didn't. And, in your brain, it just got lost. Like, talk to people, let them know what you need, let them know what's going on. Um, my mantra, especially when I'm getting home from work, don't put it down, put it away. If I put something down, it will not get picked back up. It will just end up in a pile. And so that is when I chant to myself constantly. If it's in my hand and I want to pick something else up, I'm like, nope, don't put it down, put it away. And then I can come back to my thing. And then the self-control app. This is a great one if you get caught doom scrolling. This is an app you can download and you will lock yourself out of specific apps at certain times. And unlike other apps, you can't override this one. Like there are other apps where you can kind of go, nah, override, and I'm going to do it anyways. This one, you can't override it. Uh, so once you set that time limit, like you're stuck. So these are some of my favorite tips and tricks, but these are the ones that work for me. They might work for you, they might not. Uh, okay, I know I'm keeping an eye on time. We've kept you guys like way over. Uh, Here are some additional resources. The Attitude organization is great. It's the ADD-itude. Chat is also great. A book that recently came out by a TikToker I actually like around ADHD is the ADHD Field Guide for Adults. I read through it, nice and easy to flip through. Um, be cautious with the information online. There's a lot of good stuff, also a lot of bad stuff. And thank you for coming and listening to us ramble. I hope you got some useful information from this. If you got nothing from this, our apologies, but hopefully the presentation was at least somewhat entertaining.
All right. Thank you both so much. Yeah. Thank you too for joining and giving that presentation. There was a lot of useful information and it was like really thorough. I will definitely ask for you to share the resources and the links so that I can send the email to everybody so they can tap in and use the resources that you put together. So yeah, there were a couple questions. Is CNS vital signs test enough? That's the only test my psychiatrist had me do.
Mm,
Anybody answer that?
Fortunately, probably not. That's really only going to tell you how like your nervous system is regulating. It's not really going to tell us enough about like what the brain is doing, how you're interpreting information. It is going to be a good start though. But yeah, it's not going to really tell us how you deal with like reading, interacting with that kind of like impulsivity type stuff. It is going to help with ruling out like, is it just anxiety, how you're dealing with stress though. Um, but yeah, you'll definitely also need more like that background collateral information of like, how did you do in the past? More of that like historical information. And probably some baseline intelligence measures too to see like, okay, based on where your IQ is, were you performing academically to where you should be, and some of the stuff around that as well.
All right. Yeah, I had a question. Do you need different medications if you have hyperactive versus inattentive type?
Not that I know of.
Okay.
With meds, it's a big fun mess of trial and error also. Um, we know some of how medication works, but really not enough. Psychiatry is a fun field where they kind of just gave people drugs and said, "Huh, we got something to work." And even to this day, we're like, okay, we know dopamine and norepinephrine are helpful, but even within different individuals, it's kind of like what works for one might not work for another.
Mhm.
So yeah, even with like the inattentive or hyperactive, it's like kind of all right, Adderall might work for this person, but the other person might need Ritalin, or this person might actually not even respond to stimulants.
Hmm.
Um, so it's yeah,
Yeah.
very just like personalized.
All right. Got it. Yeah, and just wanted to also share that like body doubling is something
Hmm.
that has been really helpful for me because yeah, I have found that I have really low motivation to do stuff alone. But if somebody else is doing something that is also like not fun for them,
Hmm.
then I'm like, okay, I will do the task that I need to do too, because we're both doing it together.
Hmm.
Yeah. So I don't know if that's helpful for anybody else, because yeah, that's been something that works for me. Because otherwise, yeah, it's the big task that I'm like, later. So
Hmm.
body doubling is helpful. Does anybody else have any more questions? If you do, pop them in the chat and we can read them and have Ellie and Alex try to answer them. And if not, thank you all for being here. And yeah, check out your inboxes. I'll get the resources and links that I can share with you all via email. We do have two more classes coming up offered by other team members. Oh, thank you for popping them right in there. Yeah, other colleagues of Ellie and Alex are going to be joining us in July. So we have two workshops, one on July 13th and one on July 15th. We have a class on diving into anxiety, which if you struggle with ADHD and maybe like overwhelm and anxiety, this might be one that could be suitable for you to jump into also. And then diving into understanding and working with your anger. So that can often feel like a taboo topic because I don't know, in America, I feel like, and actually in a lot of cultures, right? It's kind of just like tampered down. You need to be presenting in this sort of very specific socialized way. And healthy rage feels important for us to all like get a little comfortable with. So if you've been working with that or you're curious about any of that stuff, yeah, learn more about Banyan Tree Women's Collective. I'll pop our website in the chat as well, banyanwomen.org. And Yeah, all right. Exandra dropped in a comment. My doctor prescribed Wellbutrin to try for ADHD. I don't think it helps very much with ADHD, but I kind of got stuck taking that and haven't pressed for more effective medications. Any commentary you can share on that?
Yeah, that's actually one that my doctor had me try for a while and had a very similar experience where I was like, I don't think this is doing much. Um, I would say try pressing, let them know like, hey, I've been taking it. I don't think this is doing anything. It can be hard to have those conversations, but nothing's going to change until you bring that up. That is a common one that they'll try to prescribe like off-label, especially if they're like thinking it is more anxiety. But yeah, it's hasn't really done much for a lot of people.
All right, so you're not alone, Exandra,
Yeah.
and feel encouraged to ask for what you need and get support. Um, Catherine chiming in, Wellbutrin didn't work well for me. It just made me constipated. So yeah, you really are not alone, Exandra. All right, well, if that is all the questions we have, thank you everyone for joining, and especially for Alex and Ellie for giving this presentation and sharing your wealth of knowledge. We deeply appreciate you being here. So until next time, have a good night, everyone. Bye.